Hello everyone, welcome back to our channel. Today's topic we have divided in two parts. The first is very common problem, that is hair loss. And in second part we will see what are the various causes of hair loss so that we can effectively treat that thing. Let's get started. What is hair loss problem? If you are experiencing everyday loss of more than 100 hairs, then medically it is called as hair loss problem. To understand it better, we need to know about the hair growth cycle. Hair growth cycle is divided in three parts. The first is anagen or active growth phase. Our 90% or most of the hairs are in anagen phase and it lasts for 3 to 5 years when our hairs are growing every day and every month we get a length of hair of around 1 centimeter per month. The next phase is catagen phase. In this phase, around 3% hair follicles are present at a time, and here the support gets weakened and it lasts for a few weeks. The next phase is telogen phase, in which the hairs are gradually thinned out and they come out of hair follicle and they are shed off when we comb our hairs or naturally they may fall out. Around 5 to 7% of hairs are in this phase. And after this, again the hair follicle enters into the anagen phase and the growth of a new hair starts from the same hair follicle. So now let's move to various causes of hair fall. The causes of hair fall are divided in two parts, that is genetic factors and environmental or lifestyle factors. If we look at genetic factors, what we called as male pattern baldness or androgenic alopecia, it commonly affects males, but it is seen in females as well. If in your families or in your parents or brothers there is a tendency of hair fall and early baldness, then the same problem can occur due to genetic reasons. In this problem, usually the hair follicles are more sensitive to hormone like dihydrotestosterone and they have tendency to thin out and fall at early age. The next cause is hormonal imbalance. If hormonal imbalance is occurring due to any health reason or in females, especially during the pregnancy or after pregnancy, at menopausal age or due to the thyroid problems, then the hormonal cycle disturbs the hair growth cycle and there is tendency for the excessive hair fall. If we can understand what is the cause that is causing this problem and what hormonal imbalance is there and it is corrected on time, then this problem can be cured as well. The next common cause is nutritional deficiency. When we look at some people, they have tendency to eat more of a junk food and less of healthy and nutritious food. In such condition, in body there is deficiency of essential elements and micronutrients like iron, vitamin D, vitamin B12, biotin, zinc, etc., which leads to excessive hair fall. If someone is taking balanced and nutritious diet, they are keeping the protein intake at optimal level and taking regular supplements, then it will definitely control this problem. The next common problem is stress. Stress is commonly seen not only in youngsters but in the middle-aged population, office goers as well as the elderly persons. And this stress adversely affects the hair growth. It prevents the new hair growth. It keeps the hair follicle in resting phase for a longer time, as well as it leads to certain changes that leads to thinning of hair and shedding off at earlier time. If we follow certain things in life which can help in controlling stress, such as controlling the intake of excessive alcohol or controlling smoking, taking adequate sleep and doing certain modalities which will help you in managing stress, then the hair fall can be controlled as well. Apart from these four causes, there are other causes like medical conditions like any scalp infection or sometimes autoimmune diseases lead to hair fall. Certain medications like antidepressant medicines, blood thinners or chemotherapy agents also cause hair loss. Now, when we know the various causes, then we can effectively find out what is the cause of your problem and you can get it treated. If you are suffering from hair loss, then you should consult your doctor or a plastic surgeon nearby, get yourself evaluated, and you can take certain medicines which are available on the counter or prescription medicines or modalities like PRP or hair transplant and have good, healthy and strong hairs. Thank you.